up, world? Happy Saturday to each and every one of you. I'm Malik Boyd, host of Heart City. I am so excited to host this episode of DJ and Doctors coming together to address and fight COVID-19. Now, you know, all around the country, we've dealt with this issue of COVID-19. Mask on, mask off. That is not just a slogan or saying. We've literally fought. We've seen people deal with issues, fighting in stores, beating up security guards. The list goes on, all because they won't wear a mask. Well, here we go. Now we have vaccines, 3 of them to be exact, and states are doing their rollouts. Countries are doing their rollouts on the vaccine. However, there are still issues that we face today. Some people are saying, look, the vaccine has a microchip in it. They're going to track me everywhere I go. I'm going to get another arm. I'm going to grow an ear. I'm going to turn green. Well, we're not doctors. However, Musidora and HeartCity came together to bring DJ and doctors, the culture, and our professional to come together to talk about COVID-19, and we're going to have some fun too. We're going to spin some amazing records. DJ Miss Robin from Philadelphia is in the building, and the first guest and our doctor partner for today is none other than Dr. Linda Everett from Philadelphia. It is so good to have you with us on Heart City DJs and Doctors. Thank you.
Thank you, Malik. I'm happy to be here.
So Musidora has put together this program nationwide to address these issues. It's really ridiculous that we even have to get to this point to talk about some of these things. Nonetheless, we are here. So before we get to the music, let's get down to the nitty-gritty of this. COVID-19 is very real, but so are the vaccines. So let's get out of the myths and talk about the facts. So, Doc, this is going to sound crazy, but will you turn green or grow additional appendages by taking any of the COVID-19 vaccines?
Absolutely not. That is just false, fake, not true, a myth. And it's just, I mean, you have more of a, we put so many other things into our bodies.
Yeah.
You know, we eat at McDonald's, you know, we smoke things, we drink things that may not be so healthy. So why is it that when there's something that is that has been shown and proven and researched to decrease morbidity and mortality, why is it that has to, why is it so absurd to entertain that could be a viable option for you? You know, so no, that's just totally unfounded.
So, okay, Johnson & Johnson, when we know they came out recently with, or the most recent vaccine to date, and it was said that a competing pharmaceutical company was coming together to support them, help them build out, get to capacity and to scale because of the uniqueness of their vaccine and its storage ability.
Right.
Many were saying, look, these pharmaceuticals companies are coming together because they're planting microchips in the vaccine. And so every brother and sister is now going to be tracked by the government as if your cell phone doesn't tell you where you are anyway. But
thank you.
Let's just break it down. Does the vaccine have anything in it like microchips or things that would actually track an individual?
I don't know of any science or technology that would allow a microchip to be able to be in a vial, come up through a 30-gauge needle and be injected into your muscle in that way. Where is the evidence?
Right.
We have evidence and we have data that shows that the vaccine helps to prevent getting the disease and also getting sick from the disease. There is no evidence at all that there is a microchip hiding in those vials. So there you go.
I appreciate that. I was wondering myself, you know, the Mission Impossible folk at the barbershop had other ideas. However, you bring the facts to the table. Now let's talk about this. Tuskegee was very real.
Yes.
Black folk dealt with being test individuals and subjects for medical experiments. When we look and State Rep Parker will talk about this as well, around the country for women, and even in the state of Pennsylvania for women, dealing with medical experiences and doctors treating them differently than how they would be treated if they were of another race. We
Yes.
have some legitimate concerns
Absolutely.
about how our experience is with doctors and medical professionals. What should we be concerned about, if anything, as it relates to this vaccine?
As it relates to this vaccine, we need to be concerned that we have equal access to it as equal as our counterparts.
True.
That's what we need to be concerned with. We absolutely have legitimate concerns because Tuskegee did happen. Absolutely. Yeah. Black women do have higher maternal mortality rates. Black women also are more likely to die of complications from heart attacks because they are treated differently. Those things are true. However, right now we have to deal with the immediate concern that we actually have some control over. We can't go back in history, but we have to live right now. And this virus is a life or death situation. And so not taking the vaccine because of things that happened in the past, which some of them have really no bearing on this vaccine, or can't really be compared. That's just not good. I don't buy that. I don't think that's a good enough reason to not follow medical advice.
So, Doc, you are truly a medical professional. We see the degrees on the wall. So it's very clear that this is your calling, where your heart lies in serving the people. Can you talk about your practice, what you do on a daily basis? Because I also think that for the broadcast audience, it's important for them to know that our doctors are for real as well. Right. And we do have amazing women and men of color in the medical space who are looking out for our community and our well-being.
Sure. So briefly, I graduated from Jefferson Medical College. I am board certified in internal medicine, and I spent, I would say, a good 15 years of my career doing hospital-based medicine, and moved on, well, about 3 years doing hospital-based medicine, and then after that did about 15 years of primary care as well as preventive care with obesity medicine in my own solo practice. Since then, I am a medical director for United Health Group, which means that I am one of the doctors who makes sure that our members are getting the right care at the right place at the right time. I am the one that reviews medical charts to make sure that the healthcare dollars are being spent in a judicious manner and in an appropriate manner. And in doing that, I see these cases. I'm the one, when people get hospitalized and they are a member of my healthcare system, I'm the one that's reading these charts of these COVID admissions and seeing the care that they're getting and seeing them get better, some of them not getting better. I am reading about some of them who were diagnosed 2 weeks ago and were fine, and then they re-present to the hospital because they suddenly can't breathe or they have other complications. So I firsthand see the impact on our system. In addition, as a medical director, I have amazing opportunities to decrease some of the inequities that happen amongst certain communities, specifically the Black communities and other communities of color, through some of the vaccination programs, as well as providing tools, digital tools, and other and phone-based tools, so that our members and even non-members, the community, because we do also put on vaccination as well as testing events, so that they can get the care that they need. So I see it from the whole spectrum.
So, broadcast audience, understand we have a qualified professional of color in the space. She's here today to spend this time to address some of your questions, some of the myths you've heard. Yes, Uncle Junebug and Cousin Ray, they've got ideas about the vaccine. However, I want you to get the facts. Musidora and HeartCity, we want you to have the facts so that you know what to expect, and really so that we can kind of spread the right information around our community. So, Dr. Everett, we're excited because we have a special guest here, Philadelphia, City of Brotherly Love, stand up, one of your own, representing the 198th legislative district in the state of Pennsylvania, right here in Philadelphia, none other than State Representative Darisha Parker. Darisha, thank you so much for joining us today. It's great to have you on DJs and Doctors.
It's fantastic to be here with all of you. Thank you. If we were in person, I would give you fist bump, but I'll just give you a wave.
Virtually. We got it. So here's the thing. I happen to have the honor of knowing you. I need the world now to know State Rep Darisha Parker. She is a true fighter, a leader, one who stands up for her people, who's unapologetic about the issues and the solutions. You're in the 198th. This is an area that is super diverse. We have millionaire homes, and then we have individuals who are trying to make ends meet on a daily basis. You see the disparity of equity in distribution of this vaccine. Talk about what's happening in the district and some of the issues that we need to come together to solve legislatively and from an advocacy side on this vaccine.
Well, I'm glad that you brought up something that's very near and dear to my heart. When you're talking about advocacy and you're talking about the community, let's unpack it. One of the communities that's very near and dear to me is Nicetown. Nicetown zip code of 19140 has one of the highest level of asthma amongst African-American children. That means it's not a coincidence that it was also one of the highest level of coronaviruses in the city. So by me saying that, I have partnered with, again, the Neighbors Against the Power Plant, and we are actually activists to make sure any environmentalist issues that come to plague our community, that I'm going to let them know I'm not for it. That means those toxic fumes and anything that's going to plague and make situations worse, I'm not for that. And the reason why I can really say this is because I have asthma, and knock on wood, I have not been into the hospital for various years based on that asthma. So anything that has to do with those type of, and it may sound like a selfish plug, but that's what keep pushing me forward when you know about these things. And I'm going to make sure, I continue to make sure that environmental issue is on the top of my platform. And then you got to also make sure we're talking about our community. Let's be real clear. What's happening in Nicetown, wouldn't happen in East Falls, it wouldn't happen in Chestnut Hill, wouldn't happen in Rittenhouse Square, wouldn't happen in the Center City or Society Hill, or any other affluent neighborhood. So I'll be damned if it's going to happen on my watch in the neighborhood that is highly with African Americans. That means that we collectively need to stop talking at each other and work together. And that doesn't mean we're all going to walk and talk at the same time. But we got to agree to that there are things that are due to us in this district.
So what are the things that, obviously, DJs and Doctors, and thanks to Musidora and the great work that they're doing to make this a national platform and initiative, but what are the things that we can do on the ground? We know all politics are local, but all change also begins locally. And so what is the conversation that we need to have amongst community leaders, with leaders like you in the elected position as well, and then our medical professionals like Dr. Everett? What are some of the conversations that we need to have, or topics we need to discuss to make sure that we're on target?
I think it's the fact that they're on target. Let's talk about and how we can unpack it. If you're going to talk about locally, let's talk about the 400-pound elephant that nobody really wants to talk about. We've been a minority, meaning the Democrats have been a minority for decades. Okay, so let's take that off the table. Right. Okay, so we don't need to do the kumbaya, coulda, shoulda, woulda, because that's the way it is, and it's going to be that way for a while. Okay, so we got past that. There's also an election every 6 months. There's an election, regardless of what office that you're running for. Every 6 months, there's an election. So that means civically, if you don't know at minimum 5 individuals on your block, how am I supposed to be assist you or my staff? So I shouldn't be your first point of contact. It should be the block leaders on your block. It should be your committee people. It should be your ward leaders. It should be town watch, your police, your community relations officers, all of those tiers right there. Then you're literally coming back to me to report out after all of these boots on the ground have done what they need to do. And I just think, for me, I'm being real clear. We got to go back to the basics. Yeah. And when I say back to the basics, we got to really talk about what civics and what that means. That doesn't mean if you do have a broken traffic light on your block, that my office is going to run down all the litmus and the bureaucracy, that we don't do that. No, we're going to get it resolved. But in the meantime, I'm going to CC my counterpart from the city, say, you know what? We got this call. This is what happened. Could you please follow up to make sure it got done? That's it. It's not a slap. It's not a jab. It's that we collectively need to make sure jobs get done. The main difference from being a state legislator, yes, I am a lawmaker. My staff is smaller, and the amount of individuals that I represent, according to the census, quote unquote, is 53,000 individuals that we represent, versus before when it was 63. So when you have these windows of individuals that you're missing, now when they try to say, you know, with COVID, oh, because of COVID, because of COVID. Bye, Felicia. Let's be real clear. You knew how to communicate with each other. You still have your cell phone. You still can send a postcard. You still can do a lot of things personable and safe. That don't use COVID as a cop-out to doing things that we can do as a community and together. I'm not saying I'm gonna run across the street and kiss my neighbor, but I'm gonna walk out my house with my mask on. And there's just things that communally we should be doing together.
So it's interesting you said that. First, I'll send you the text. You know, it's a virtual kiss. You know, now we'll have the emoji, right? But here's the thing, Dr. Everett. Look, we have passionate lawmakers like Representative Parker who are saying, "Look, I'm going to fight through the halls. I get it. We're in the minority, but we will pack a Mike Tyson-like punch when it comes to our people." What are some of the things that you need to see as a medical professional and the medical community needs in terms of resources from the state? Because as much as we yell at CNN about Dr. Fauci and what didn't happen and what could have happened, it's at the state level by which much of this is being handled. How does the state help you make sure that we're healthy?
I would say just the partnerships, you know, just like the state can't do it alone, the medical professions can't do it alone, the insurance companies can't do it alone. We all have to work together. For instance, you know, the National Medical Association, the chapter that I belong to, First Chapter in Delaware, we have great intentions of administering the vaccine, as do many organizations. And we have been successful in that way. But the only way we've been successful is to be able to partner with our state, to be able to secure building. Sometimes we need extra staff to be able to assist with registering people, doing the data entry. So it's not, the administration of the vaccine, we've got that part, that's fine. Right. But sometimes we need other assistance. So especially administrative assistance. So that partnership is really key when you're trying to make an impact.
So can we stay there for 1 second?
Go ahead.
Can we stay there just for 1 second? One of the things I gotta make sure we say it. I had to make my own living and my own opportunity, but I made it. Don't sit down and wait for opportunities to come. Get up and make them. That was by Madam C.J. Walker. Yeah. And the reason why I'm saying that right now is there's a lot of internal fight that's going on. Right now, let's unpack it. People are very upset in the counties because they're talking about Philadelphia, because you know why? Philadelphia went and with our Department of Health and went to make sure we had our own vaccine. So the problem is with our counterparts in the other parts of the county, they didn't have that opportunity. So they're upset with what's happening in Philadelphia. But by them being upset, there's a whole lot of other chaos that's going on. So as we're probably cheerleading one way with Philadelphia, we're screaming in the other arms because it's not a cookie cutter type of conversation. The reason why I can see the green light for the doctors and other partnerships, because my white counterparts, Republicans, their constituents can't get the vaccine. So that's why I feel that there's going to be some funding at the end of this tunnel, because their constituents cannot get vaccinated. They have to drive an hour to 2.5 hours to get the vaccine. And I'm telling you, and let's be real clear, let's call a spade. If that did not happen to my white counterparts, we would not be here today.
That's why it's going to change. See, that's why I love you, Darisha, because I was going to let the people talk for a minute, but you went to the next section. So you started a little early. I love it because you're so right on this. Equitable distribution is a challenge across the board. As Black and brown folk, we're like, hey, we don't have enough, but there's some other folk going, we don't have enough too. And so, there's this manufactured rumble that they're creating amongst the states, and now politics has again gotten in the way of total health and wellness. And so it's very crucial for us to pay attention to that. For the broadcast audience, thank you to I believe that's Jill Parham for your comment about Dr. Everett. Yes, we have a superstar medical professional and a superstar legislator in the building. Danielle Page Jeter jumped on and said, hi, Malik and Darisha. What's up, superstar? We see you handling your business down south and doing your thing. Chad Johnson, thank you as well. He said, look, they could put microchips in alcohol. They could, Chad.
They could.
Especially in the Hennessy that I like to sip on every now and then.
It's so interesting they saying that about the vaccine.
All right.
Right. They can say that about the vaccine, but good and darn well, every time you get an email address or a cell phone, big brother. Yeah. But I'm just saying. Okay. I'll quiet.
I mean, we act like we didn't see enemy of the state, right? But okay,
Alexa knows all. Alexa and Siri know all of our business.
Absolutely.
Alexa, Siri, and who else is there? Google somebody. Hey, Google.
Yeah.
Alexa has been interrupting my conversations for the last year. I'm like, I didn't even say your name, sis. I don't even know you. Like why you in my conversation, right? But we're mad at the vaccine, and so broadcast audience, I want you please to type in your comments, your questions into the chat. I'll make sure that we get them in these next few minutes to our superstars. Rep, listen, let's talk about sites.
Yes.
Okay, because you and I just had a conversation in the green room about it, but I think publicly they need to know. Black Doctors Consortium, yes, you've seen them on MSNBC, CNN, and the like, but there are many folk that are doing the great work of making sure that vaccinations are happening in our areas. In your district, talk about locations and where people can go in the 198th legislative district.
I was very proud on a Saturday rainy afternoon. I stood 4 hours. I didn't want preferential treatment. Malik, you guys would have been laughing. You wouldn't even know me. I had a scarf on. So I could just be like a regular person, because how could I go to Harrisburg if I wasn't in it with everybody else and tell them from firsthand experience? Then when my staff maybe took my scarf off, they was like, wait, Rap? Wait, you in line with us at Triumph? I was like, yes. I was like, I don't want special treatment today. I got to tell them what really happened. And I was very proud that they had it at Triumph consecutively. I think next weekend, maybe the last weekend of this month. I was also happy that the city has also had it at Mastery Simon Gratz. That made me feel good in Huntington Park. I'm also excited that Nicetown CDC, along with the Philadelphia NAACP, and along with the Kroc Center, is doing it at the Kroc Center this week. And lastly, and I don't think I've missed any, but if I have, you'll text me. Oak Street Health has been rolling up their sleeves and doing it a lot. They asked me, hey, Rep, would it be okay if we use your face? I said, go for it. If that's going to help, then go for it. And I just said, now is the time, in addition to the pharmacies and Temple and everybody else that has it in our district. If I know you have it in our district, call 215-849-6426, and my staff will make sure we do it. I've also made it easy and accessible for individuals who are computer savvy. You can go to my website, click it, fill out the information. If you're still still not sure, call our office. One of the interesting things that I did, Malik, you would appreciate this. I had a Bill Miller moment when I cussed out some of the people from Rite Aid, because I said it's not fair that you're telling me to push them to Rite Aid and they can't get in. Right. So we're going to be doing some pop-ups with some other pharmacies in the districts too. I know I was supposed to give 2 locations. You know me, I gave 4. So this is going to be a time that if you're in the 198th district, wherever you are, we're going to make sure it's available to you. Another thing is, I just read that Dr. Alice Stanford, kudos to that sister, and the Black Docs, they're doing home visits.
Yeah.
Home visits. Okay. Yeah. So That is good. And out of that Black Doctor Consortium, you have a group of sisters who are the twin docs. One of the doctors, Dr. Woodlaw, is my doctor now. And this is what happens with all of this stuff, Malik. If you're going to be a person that's in this district, lives in this district, and you're fighting for this district, then I need to have a doctor that's on the front line doing this work. Yeah. So I said, you know what? I'm going to make you my doctor. She was like, what? You my doctor. You doing this work? We're going to talk offline what you need, and then we can work together, and you're at Temple. Mm-hmm. So I went ahead and made her my doctor, my primary doctor, so that we can really have real conversation about things that I know, things that she knows, and then we have a safe space. Because I feel like, again, for us as a people, we have professional individuals who are doing this work. I just wrote down the sister, Dr. Kizzy, the woman, the Black woman who Dr. Fauci praised for this vaccine. Yes. So absolutely, we gotta give science and credit for where it's due. And again, I don't want to get off script and get in trouble, but if you have questions as it relates to where you can find a vaccine, we do have a link that's going around, and there's other places throughout the city, but I was just one of Conan on 198th. I'm at 215-849-6426. And a lot of people were like, how come Rep Parker, we can't come by your office? Because it's COVID and we got to be careful. Right. But Malik, you would love to know that building is Black owned, Black managed, Black everything in that building. Okay. We got about, I think about three Black restaurants is coming. I got 3 barbershops that are in there, beauty salons. It's like a whole lot of businesses in this hub. And guess what? The owner of that property, he is now a vendor of the state, because now I'm making sure our dollars get circulated. So that's the kind of story that I need individuals to be aware about.
That's the Black business segment. That's going to happen on another show, but that's the work that gets done when you have a responsive state representative. Listen, so Jean Felder, she's from South Carolina. She said, hello, Dr. Everett. Thank you for this forum and for providing valuable information. Orlando Acosta said, hello to the state representative, Parker. This is Orlando checking in. Thank you, my brother. Listen, Jill Parham said, how can doctors, let's do this really quickly. We got 2 minutes. Dr. Everett, how can doctors get vaccines for their private offices or pharmacies? And some counties can't get it. What's happening with that? What's the distribution about?
So that's a good question.
That's above the pay grade. Let us know. You know, if it's G5 classified, let me know. I'll fill in for you.
So Jill, I do know that there is a process for doctors to be able to get the vaccine. There's a form that you fill out on pa.gov if you are a primary or a provider looking to get vaccines for your patients. Now, me not being in that category, I haven't gone through that process, so I can't tell you what the selection process is. However, that is a process. Now, why? And the second part of the question was what, Malik?
Well, it was tied into one. It was saying that, you know, some counties can't get it. Obviously, it's all going to be about the process at that point. But if you tag me in, treat me like a Saturday WWF wrestling. Tag me in for this one. Here's the deal. You need active state representatives like Darisha Parker. You need folk who are going to sit at the table and make sure that your county gets it.
Their allocation,
because closed mouths do not get fed, and that's what we elect people to do. And so let's look locally, look at that leadership and say, hey, why does my county not have what private practices have? Okay. And if you're not getting good answers, well, as Rep Parker said, there's elections every 6 months. You get a chance to redirect and re-elect. That's a story for another day. Rep Parker, you are truly a leader. We appreciate you for all that you're doing for the 198th and for the state of Pennsylvania as well. Thank you so much for tuning in and joining us today on Heart.
I appreciate all of you, and just make sure that everybody knows when we did the tag team for you. Make sure, as we are beating up on Philadelphia, they did, have their own, vaccine. So don't think the other counties, it went on deaf ear. They have blasted Governor Wolf and his administration. I just had to put that out there. But civics, Governor Wolf can't make other entities get the vaccine. That's just keeping it 100. Philadelphia went and has their own vaccine, their own situation. We don't even know how many, they even talk about how much more we will be getting per week and how that's going to be, distributed amongst certain districts in the city. And, they're working everything out. We got to also talk about, we got a new Secretary of Health, new secretary. She's interim, Harry Levin is in the White House right now, so, think about what happens when you're in the middle of a crisis. The person who got you through the storm is gone, and now you have somebody new that's trying to figure it all out. So I'm not pointing fingers and blaming or passing the buck. We just got to sometimes unpack it and have these real conversations. Now that we know it's here, let's get the solutions done.
Keeping it 100 in the 198. Rep Parker, we appreciate you. Thank you so much.
Thank you.
So you've heard from State Representative Darisha Parker, the 198th District. Make sure you check her out. She posted her contact information for her office. She's doing tremendous work to make sure that the district and the state of PA is super responsive as it relates to the issues of the day. Dr. Everett, we have a music component.
Oh, good.
With us as well, right?
Yes,
and clearly it's bloodline for you. A little birdie told me that your sister, our DJ Miss Robin, is on the line and ready. So I want to pull her in really quickly. DJ Miss Robin, welcome to DJ.
Hey, DJ Miss Robin. Hey. How's everybody doing today?
To see you. Look, so I heard you. We've got some recommendations. Rep Parker put in house music as a recommendation. You see, I got my Feli sweatsuit on. My Lottos, I didn't clean them all the way, so I just got kangaroos on. That'll skip over some of these young folks' head. I'm ready to hang out with you, but before we go, I want you to talk really quickly about something. The music community has been impacted by COVID-19. It's not just the party goers that are unable to hang out and enjoy, but DJs have had challenges finding work and the like. And so getting the vaccine, getting us back to normal or a new normal is so important. Talk about really quickly in 2 minutes, talk about the impact that COVID-19 has had on you and the music community and why it's so important for this vaccination to happen.
Well, thanks everybody. Again, my name is DJ Miss Robin, and I'm also a longtime fitness professional. So I was impacted doubly by the coronavirus. Gyms were shut down and bars and clubs were shut down as well. The one place where I do my residency, Bob and Barbara's, which is on South Street, hi everybody, it's very small. So when they did reopen, I still haven't felt safe enough to go back out into the fray. So for right now, I am happy to be here live for all of you now. And Darisha, I'm playing this one for you. I don't know if you can hear it in the background, but got a little house music going on right now.
There you
go. But yeah, it's impacted all of us.
So broadcast audience, understand it's so important to get a vaccine. Talk to a medical professional if you don't feel comfortable about it. Rep Parker talked about home visits are happening. Look, it's my six pack. This is the way my six pack is set up. I don't know if I want to lift my shirt up to get the needle, but I can find someone who's willing to give me a needle and give me this vaccination in a place that's safe for me. If you feel like transportation is an issue, call Representative Parker's office. Let's talk about how to get a mobile application out to you. Above all, we want everybody back to at least what we thought was a normal space. Dr. Everett, before we go, thank you for all that you do. It is so important that we all understand that there are people of color qualified in the space to deal with the facts, the issues, and the administration of this vaccine. We are not alone. We have leaders like you in the space. I need you to know that we honor you and appreciate you. In the next 30 seconds, tell the broadcast audience anything you need from your heart to our heart for us to hear.
Yes, thank you so much. Thank you for having me. And yes, I want everyone to know that you're either a part of the problem or you're part of the solution. The only way that we are going to be able to eradicate or even approach eradicating this virus is if we all get vaccinated. We're either going to have to get vaccinated or we're going to have to catch the disease and develop immunity that way. It's one or the other. There's no other option, okay? So by getting vaccinated, you are doing your part to help other people in your community. And in addition, take on some responsibility and assist someone else in getting vaccinated.
Yeah. So you have heard it from an amazing doctor, Dr. Linda Everett. Thank you so much. I'm looking at the feed. Jill Parham said, yes, thank you, Dr. Everett, for all that you do. Pamela Rich Wheeler, a legend here in the Delaware Valley, said, thank you, Malik, Dr. Everett, and State Rep Parker, and DJ Robin as well. We want to thank you, Pam, for all of the amazing work that you do in the space. Dr. Everett, we appreciate you. We've got your back. Thank you for covering us.
Thank you. Thank you for having me.
So it's up to me and you, DJ Miss Robin. We are here. We talked about the issues. No, your ear will not turn green. You will not grow a second nose or a seventh finger. You shouldn't have 6, but that's a story for another day. Some of y'all get that on the ride home. And you won't have a microchip in the vaccine. This is simply a vaccine that they all came together. Quite frankly, they were doing the research anyway prior to. And so some of that research was applicable to this situation. Countries worked long and hard to get us here. No, I don't like needles, but vaccinations are needed. I'm not always sure that I feel comfortable in medical spaces, but that's what we have people of color who are qualified in the space here for us to talk with and talk to make sure that we are comfortable. I get it. I know Tuskegee happened. I know that the challenges that we face in our community around medical professionals is many. It's many, and it's a lot to overcome. However, we have people of color who are qualified, who are ready to help us and guide us through this process. Now that we have gotten all of the issues out of the way, DJ Miss Robin, it's all on you. You are going to take us out for DJs and doctors. This episode has been presented by Musidora, a great program who's working nationally to make sure that DJs and doctors come together to fight COVID-19. DJ Miss Robin, take it away.
Hey, party people, Little Philadelphia and beyond. Thanks for joining me today. Thanks for listening. Hopefully you learned something from my sister, Dr. Everett, and from Representative Parker. So I'm going to be singing a little music today. Whatever hits me, whatever feels good. Hope it feels good to you, too. Let me see your hands out there. Let's go. see you dancing out there. I see you. Where they at?
Several times. Listen to it from a location midway between the last fingers. 1, 2, 3, place. L. Keep on, keep on.
Hands up if you're vaccinated. Hands up, hands up. You know you gotta do it. Yeah, that was my sister, Dr. Everett. Hey girl, hey girl. Happy first day of spring, everybody. How could I forget? And it's daylight savings time. We are blessed. Hey, Malik.
DJ Miss Robin, can you hear me? Can you hear me?
What's up? I can, yes.
Look, here's the thing. Saturday afternoon was for us to prep and get ready for the club. But,
right.
Masks aren't sexy, right? Like, it's hard,
right.
the house with mask on. And so vaccination is so crucial. You gave us some cleaning music, some traveling music, some vibe out music on Saturday afternoon. For that, I'm so grateful. I know the broadcast audience is. But tell everyone who's been vibing out with you for these last few minutes how they can follow you, stay connected with you, so that once we come back to whatever our new normal is, they can be with you on the dance floor.
Yes. First of all, you can follow me on Instagram. My handle is @the_notorious_. R as in Robin, M as in Marvelous, G as in Gillespie. Again, my IG handle is the notorious _ RMG. You can also follow me on my full name, Robin Marcel Gillespie. That way you can see all my playlists. I'm always curating new lists, so you can follow me there. And otherwise, hopefully I'll just out in the universe healthy, wealthy, and wise.
DJ Miss Robin, you are a superstar. Thank you for all that you do. So we've heard from DJ Miss Robin. She gave us some good vibing music. I hope you enjoyed it as much as I did. Look, I want to get back on the dance floor just like you. I want to enjoy the club scene, the nightlife, just like you. Here's the deal. We have to get vaccinated. We've got to deal with the issues. Fact, not fiction. And the truth is, you know, herd immunity without having this level of impact from the medical community it's a stretch. Because we got some folk that like to just go to South Beach and hang out knowing good and well that they haven't been vaccinated, putting us all at risk. We got some folk in the inner cities, if we're going to be honest, having day parties and things of that nature, keeping us all at risk. And it's not just us who wants to get back to normal, but we've got to protect our seniors. As vulnerable as they are, there's no reason in the world that we should be putting our seniors at risk by being irresponsible. So here's what I need you to do. If you haven't received your vaccine, have a conversation with a medical professional, talk to the Black Doctors Consortium, get vaccinated. Deal with those issues, ask those questions, do whatever you need to do to feel comfortable. If you've gotten vaccinated, but Uncle Ray didn't, we got to have a conversation with Uncle Ray. Junebug. Y'all know if he's willing to show up at the barbecue and you want Uncle Junebug back at the barbecue, he's got to get vaccinated. We don't want to put him at risk. It's so important that we make sure everyone is vaccinated, that they have the facts, that they're asking the questions that they need to ask for their own medical challenges or issues, whatever your medical profile is. Make sure above all that you have all the facts, all the information, because the resources are coming your way. DJs and Doctors, presented to you by Musidora. Great initiative working around the country to make sure that communities of color are vaccinated and covered with the facts. Heart City has been, it's been an honor to be a part of this initiative. We are excited about the next set of cities, the next set of DJs, the next set of doctors. Enjoy your Saturday. Thank you so much for tuning in to DJs and Doctors.